discussion. So thank you so much, Aninda.
Thank you so much. I mean, that was fascinating. So it is my privilege to facilitate the panel discussion with Aninda, Gurch, Pallavi representing the Mohan Foundation in India, and Rachel, one of our amazing specialist nurses in organ donation. Aninda, Gurch, and Rachel have already been introduced, but I would be remiss if I didn't introduce Pallavi. Pallavi is the Executive Director for the Mohan Foundation, which is a leading organ donation and transplantation advocacy organization in India. I've had the good fortune of working with Mohan Foundation, and I've also had the good fortune of listening to Pallavi speak. And I thought it would be best that we started first with Pallavi giving us a brief summary of what she does and also focusing on the question. I mean, we've discussed this morning. When a family say no to donations, citing cultural barriers, what do you think is the best response from the person who approaches the family? Pallavi, you've had the task of actually organ donation advocacy in diverse parts of India, the Northeast, the metropolitan cities, the West. So, what are your takeaways from your experience? But if you could just give us a brief summary of what you do. Thank you.
Thank you, Radha. Thank you for having me here. Thank you, Vinny. It's a great privilege to be here. I represent the Mohan Foundation, which is a 29-year-old organization working primarily on organ donation in the country. And it's really a 360-degree approach, of course, creating public awareness, but working very closely with hospitals, helping them set systems in place. For the longest time, we have been training this group of people called the transplant coordinators. I think you people use the word SNODs, or the terminology that we use in India is transplant coordinator. I'm not particularly a big fan of that word, but that's the word that the Act uses. And these are the people who speak to families at the time of death, of brain death. The foundation has had the experience of working across cultures. Of course, I'm primarily in the South, and now in the last couple of years have started working in the northeastern parts of the country, which are relatively more untouched by these conversations. Um, my One of the things that I really wanted to convey, this is a question that I very often ask every time I train. I'm standing in front of a group of coordinators, as we call them, or doctors. We have to ask ourselves, why are we asking families for organ donation? And invariably, in most of these groups, the answer that I get is, we ask because there's a shortage of organs and many patients die waiting for a transplant. You know, and while that is true, I really want us to start re-looking at our ask. And I believe, and I think many of you out there probably do also believe, that our first and foremost reason for asking is that we believe that every family has the right to be given that choice. It is their prerogative to be asked, and ensuring that opportunities extended to them should be our primary objective. And we have to believe in that. And that belief that that is the primary objective, this family here, and we believe that this family has the right to be asked, that if we do not ask now, they miss this opportunity to take a decision to donate organs for themselves, for their loved ones. That should be reflected in our spoken word, in our body language, and in every interaction that we have with the family. So that is something that I really, really feel that I wanted to, because very often in our context, when I ask the coordinators, their answer is, oh, there's so many people dying, there's so many people on the waiting list, and that is why we ask families. And of course, the conversation and the decision they take ultimately will impact families and patients. That's a different matter, but that is something
No, you're right. You're right, Pallavi. It's important that we give them that choice. And if a family cite either cultural reasons or religious reasons, what is your experience and how we can explore those issues with them?
So it's actually very funny, Radha. I mean, when I started work 15 years ago, I was told that religion seems to be the primary reason for families to say no. In all these years, it's been about 15 years, and I've counseled many families and have got abundant no's. Also had beautiful families
think we've lost Pallavi there. I might just move the question to Rachel. Rachel, when a family says no, and you've got the most sort of front line on the ground experience with that, what what are your sort of pointers or tips to those in our who are listening to us today about how we can explore that with the families?
Thank you very much, Radha. First of all, we all need to understand that every family is unique. And I normally, when the family say no, I try not to get to, well, initially when I meet the family, I try to know the family first, know their belief and what is important to them. And if I don't know much about their religion, I ask directly. That way, I'm not guessing. And many people would appreciate that you open that conversation to find out about their belief. And that even works, even if it's just about the potential donor, to find out more about the potential donor. So I usually ask openly to find out. And in terms of what I would say if they say no, I will just gently probe them to what is the reason they may not agree to donate organ, and so that I can easily clear out some of the misinformation that would come out at that conversation. And obviously asking questions like, tell me more about what you've just said, and tell me, can you just discuss this further? And they will feel that you are interested, and they will open up that conversation, and you will be comfortable in a position to start answering from the actual fact. And
Thank you.
I wanted to point out, I don't know if I'm talking too much, one of the clear religious issues that we do get, and I've witnessed one, is the Jehovah's Witness. I had a family, they said no, and so there was a mom, she said initially, that was the strong no, that you can't even turn around, probe or anything. And then I just wanted to know more, because that was actually my curiosity, because I've never seen a Jehovah's Witness potential families before. So I asked them to explain to me more about what they didn't want. And they talked about blood. They brought up the cards that they can't donate blood. And that gave me the opportunity, because they wanted to talk, to explain to them the process in theater where we flash with fluid, and some of the organs, the only way blood can cross over will be the heart. And I gave them the opportunity to put a restriction on heart donation. And they did point out so many other things that while talking, I tried to clarify. And when they got all the information, they realized that actually we can still be potential donor. And mom diverted the conversation to what happened in A&E, in the emergency service, the treatment that they received there, which they didn't like. They then pointed out that this case will be investigated. It will be the coroner's case, which I knew that you can be a coroner's case, and we can still refer to the coroner and ask if you do. So I had to clarify all of that. But in the end, it was still a no, because they were holding on of the poor care they received in A&E. So that wasn't religion anymore. That was another reason. So this is just what
Thank you so much.
Gently try and probe an open conversation if they're willing to talk.
Thank you. Thank
you
so much.
Please mute yourself. Thank you.
I'm just going to ask Gurch, from all the work that you've done in so many countries across diverse communities, if a family were to explicitly state that it's their culture or their religion which is a barrier, what do you think we should do? Do we probe, do we explore, or do we signpost? What are your sort of inferences from the vast body of academic work that you've done?
So I guess there's two issues here. So firstly, we have to remember our history as a country, and the history is different in every country. So let's not forget that sadly in this country we had something called the Alder Hey organ scandal, where I think it was about 800 children's organs were taken without any parental consent. And that history doesn't diminish. So that trust and rebuilding of family consent is really important because I served on the board of the Human Tissue Authority. I can tell you that people to this day still feel very understandably hurt by that. So I think, taking families' views is a serious endeavour, and it needs to be dealt with in a very sensitive way. And I guess in terms of how to deal with it, if people, for example, raise religious or cultural issues, easier said than done, but I've seen this and watched it happen, is in the work I described earlier on, in the work we're doing out in Barcelona at the moment. We're taking this partnership approach whereby the sort of specialist nurse for organ donation type role, they don't necessarily do the family approach on their own. So with families where, for example, religion and culture is surfaced, they build that dialogue in partnership with a local faith leader. And then the local faith leader supports the family into offering counselling. And it still might be that the family choose not to donate their organs, but ethically, at least the family receive some emotional faith support from someone they recognise. And I think that's the right thing to do. Now, there's the reason that happens well in Barcelona is because they've built those bridges with the community. So the hospital has gone out to those communities and they now know who those local faith leaders are. They've brought them in to show them the work they do. They've spent time so that when faith leaders then are put in that very difficult position of talking to a family, they actually, with all due respect, know what they're talking about rather than having to speak blindly. So a lot of this requires time, commitment, resource. But I would argue that given the waiting list figures in the UK and given the demographics in the UK and certain parts of the UK, this approach should be, if you like, the way that we do it, because we don't have, I'm envious of what Aninda shared. We just don't have that diverse workforce because our pool of potential synods isn't there. Because we've got so many inequalities in the nursing workforce, junior level progressing to senior level, that we just don't have enough eligible people. So we'd love to get to where Aninda gets to. So in the short term, we do need that partnership approach with faith leaders at local level.
Thank you so much, Gurch. I'm going to come to Aninda. I think Pallavi is back, but I'll go to Aninda and then to Pallavi. Aninda, from your appraisal of the use of your tool, is there any sort of learning about the approach? I know we talked about the match, but is there anything about the agility in the approach? If a family were to put up a barrier, is there anything that your successful people do the approach, the success, the degree of success improves if they change their approach in a way? Have you studied that bit of the pathway?
Yeah, no, thank you. This is definitely something that's evolving, and we are learning, how to get better and further utilize this tool. What really it has done, to kind of like the context that you're talking about, is it really showed us what our weak spots are. I think that was, obviously we want our people to succeed using their strengths, but it also put a spotlight on what are our people really struggling with? Is it really the time frame? Because, we often find that with people of color, you need more time to get to that yes, right? That is an important consideration, and we cannot be naive about that. And so what are the characteristics of your people? Like if they are, they're stressed when there is a shorter time frame, that really produces bad outcomes. So again, there is so much to learn and understand and how you apply it. But yeah, for us, really trying to understand the weak spots, where can we train our people, what adjustments can we make at our hospital environment to give them more time or to give them a better environment for donation discussions. Those are the things that we are constantly looking into and challenging ourselves. What can we do from a leadership level to make those difference?
That's so impressive. And I think I'm hearing about partnerships, changing the environment to make it easier to actually understand the questions that's being posed and say yes or no, depending on what they feel. Pallavi, are you back? Your camera is off, but you're on. So I'm going to bring the question back to you. So if a family were to cite religious or cultural reasons as the reason for no, do you have any tips to share with us about how we should explore that?
Sorry about the earlier hiccup.
No
Uh,
worries.
I also wanted to emphasize here that a no is sometimes the easiest thing for families to do in that situation. They've just lost a loved one, they're grieving, there are 20 other decisions to be taken. Now we are kind of saddling them with another very incredibly difficult decision of organ donation. And very often, no is the easiest answer. And as coordinators or as snods, we have to train ourselves to, really to strike a balance between being overly persuasive and giving up too quickly after an initial no. Uh, and and that really allows us, a space for understanding and, a dialogue and, looking at what were the reasons actually to say no. And sometimes, like I said, I have not had too many families quote religion as a reason for refusing consent, really, honestly. And families that I have been talking to are asking more intelligent questions. They want to know where the organs go, how they're being allocated. There is a huge mistrust in the private sector here in our country. As you know, we have a different health system here. There is anyway a huge mistrust, and then there's the whole billing thing, and then suddenly people. So there are more intelligent questions, and I think we really need to. I don't think families are in my context, really. I don't know about Gurch. Really, people are saying that my religion does not allow. I actually haven't had many occasions where families have said that, but I have seen families refuse and use reasons which, when further explored, have moved towards consent because it allowed them to give more time to and thought to organ donation and the real
Thank you.
reason to donate. Yeah.
Yeah, thank you so much. The next question I have for all of you, and I'll go around the room, I'll start with Aninda this time, is what would your suggestions to create a safe space for open discussion around misconceptions of organ donation with communities be? How do we create a psychologically safe space for us to speak what we're thinking about healthcare inequities in the donation and transplant space?
No, that's a great question. And, I don't know if I'm the right person to answer this amongst this panel that you have, but one thing that really, when he talked about the AMAT conference in San Diego last year, and we just concluded the one this year, and I was struck by something someone said, and I'll just say that here. A lot of these trust and the mistrust and building the trust in the community really happens at grassroots levels. We can say all the things, but there was this speaker there at the AMAT that talked about barbershops. And, as Black people, they only go to certain barbershops, right? You cannot walk into any barbershop. But this barbershop really built, talked about donation and pulled so many people from their community. And it was just inspiring to hear what this one person could do at a grassroots level, helping the community understand. And that's a safe space. Like you said, what is a safe space? A barbershop. If you go in, that's a safe space for a lot of Black women in the community that we are talking about. And I'm sure a lot of you can relate to this. And that's kind of grassroots level messaging, I think it's a great way to do the advocacy.
Absolutely right. And we have a very successful community engagement project as well. Gurch, I'll come on to you next. How do we provide that psychologically safe space for us to all have these open discussions, regardless of our background or ethnicity?
Thank you. I guess there's different layers to this. So the first is, if you want any behavioural change, you need to see people who look like you, who sound like you, who've gone on that journey. So we need to know and see and hear the inspiring stories of those living donors, the deceased donors, the donor families, and have those very visible in communities at local level and at national level. So that when people start to have those conversations in safe spaces, they've got points of reference that they're having the conversation about. Because otherwise, if it's about an abstract act of someone that, I don't know, only other people do or well educated people do, then people aren't going to take it seriously. So that's point one. I guess the other point is, as I said earlier on, you can only have a safe conversation if you're willing to talk about the current issues that are going on in a country. So if you're a member of the public at the moment and you're seeing the data that shows that racism against NHS staff is at an all-time high for people of colour, those members of the public are going to wonder, well, if the staff are being treated that way, why would me as a member of the public or a family be treated any better? And we need to at least be open to having that conversation and hopefully reassure people that there are proactive plans in place to tackle that racism against staff and ideally a zero tolerance approach to it. Now, the problem with that is not all NHS trusts take a zero tolerance approach, and therefore that doesn't build trust. And I think we just got to be open about these things, that there are inconsistencies in how racism is tackled in this country. And again, to suggest otherwise, I think is, giving a veneer to an issue that's incredibly serious. So I think, safe spaces equate to being honest. And sometimes we find it difficult to have those honest conversations.
Thank you, Gurch. You make a very valid point. Pallavi, how do we create those psychologically safe spaces to have difficult conversations about organ donation?
I tend to agree with Coach. We're coming out with more positive stories, uh, demonstrating how you know families feel good about having had taken the decision much later. How it helps them in their grieving process and their coping process. Oh, so definitely that. Also, also the kind of language we use around this whole conversation, even not just outside, even within the hospitals, uh, even when families do not consent, what are the kind of language we use, saying something like family was unable to give consent as against saying family refused. We do that in hospitals. uh, Phrases like, I think the family is requiring more time to decide as against, oh, this family is taking too long, this family is very. So how we we our language inside the hospital, even if the families don't consent or if families are taking longer to consent, saying something like the family chose not to proceed at this time, so because these are the people who also go out and they become a spokesperson for the process that happened inside, so I think we have to be very careful about how we address these conversations within the family, and of course safe spaces outside. Also, I feel a lot of emphasis is placed on this final conversation with the family by the snots or a counselor or a coordinator, whatever the word that we want to use. However, a lot of good or a lot of bad has already happened from the moment this family entered the hospital, till this point here. And this conversation is going to be a culmination of all what this family has experienced from the moment they entered into the emergency, and during the time at the ICU, what kind of communication was kept with them, what kind of transparency, how much did the hospital team make this family feel like partners in this whole process. And then naturally, in this whole decision, it just flows in this whole end of life situation. So I think a lot of pressure and a lot of importance is placed on this final conversation by the counselor, and a lot needs to be done prior, not just outside, as Butch is saying, and creating safe spaces for discussion, but also when, the family as they've entered and have had this journey leading up to this point of declaration of death and this conversation
You're
around.
so right. You're so right. It's a sort of the effect of cumulative experiences, isn't it? Rachel, as the person who actually approaches the family, how do you think we can construct psychologically safe spaces to discuss these inequalities with communities?
Yes, I would agree with everyone else. The grassroots in the community is the main place to discuss organ donation. When they ask question, you can easily around the coffee, you can discuss it, clear up any miscommunication and talk about it. I was really impressed listening to all the talks in the morning about how much work is being done in the community. And I know there's a room for a lot more to be done. And I really liked the work that they're doing at university specifically, because young people at university, I experienced it myself with my daughter. She is on the organ donation register, but she spent 2 years at uni, and she last time she usually come around with me for organ donation week to promote organ donation, but she refused, and she was actually thinking about opting out from the misinformation that she got in at university. And we had to have a proper conversation, and in the end, I told her if she still wants to opt out, I will support her. At least I know where she is, but she needs to know the truth. And all that information, she was bringing up a lot of stuff that she got at uni. They had like a scenario, which was really interesting, a scenario about organ donation and minority ethnic. They had a scenario, and most of her friends, in the end of that scenario, when they asked each other, did you agree to be a donor? And they were like, oh, no, no, no. And then they were bringing up some information that they know, depending on what culture they were coming from. And my daughter was opted in, and she felt embarrassed that she was almost the only one on the ODR. And she started thinking about it, and she brought up things like, I just want my body to be left alone. I said, where did you bring that? She said, yeah, most people at uni, they said that. Even though from university, I don't know how the conversation was, but I'm really happy that a lot of work is being done at university and the community, because it's sometimes, like Professor Gadawa said, sometimes when we are at that end of life conversation in the hospital, there's a lot of mistrust in the healthcare system, and it's difficult to shake that with, even if you create, because usually when we approach family, we are in a private room, safe space already, and allow the family to discuss that. But if they have a mistrust in the system, it's difficult to shake that.
You're so right. You're so right. And we would think that the youth may view it differently, but that's an assumption we make. You're right. And again, it's about language. I don't want anybody to do anything to my body. My body is my own. So no, that's really, really fascinating. Thank you so much for sharing that. And then the Network West has seen such a tremendous increase in consents from Black and ethnic minority groups. And you have mentioned it in your presentation, but you could go over what do you think are what could you attribute this success to if you could choose one thing?
Yeah, no, thank you. There's a saying, right, that, if you want good health, it's, your diet and exercise. We hear it all the time. But there's also a saying that says, you cannot exercise your way out of a bad diet. So, you really have to understand those fundamentals, right? And for us, and that's why I try to do that in my presentation. AI is great, you can do all this deployment tool and all of it, but at the foundational level, it is that strong leadership and leadership that really not only acknowledges the need, but also intentional about and strategic about doing things to solve the problem. And then, it's about finding the right team, the right balance, and the right culture in the team. I think those, you know, those are foundational. You have to do it before you can do anything else. So I think that's really, really important.
Thank you so much for that. We asked our specialist nurse team in the whole of the UK to give us questions that they would like our panel members to discuss. And one of the questions that they shared with us was that it's quite an inconvenient discussion when people of ethnic minorities talk about waiting lists, about the fact that they're waiting longer for organs. We have to also refer to the fact that if we don't donate, that donor pool doesn't increase. How do we have that conversation? Gurch, do you have any sort of advice on that? Because that's a really sensitive thing to discuss. And we do need to increase and improve the diversity of our donor pool.
We do, but I think, firstly to say the specialist nurses and transplant coordinators, the roles that are described differently around the world, they do fantastic jobs. Let's not forget that. But they are, as Pallavi has said, at the end point of a set of circumstances that families have experienced in their life. And you can't just pin all your hopes on a successful conversation at the end and suddenly hope that all these misconceptions, lack of trust are going to be resolved in the last few hours or last few days of a family's time with their loved one, and I think this is why I think it was Kirit who gave the challenge earlier on this morning, that if we firmly believe that, for example, the community grants program is effective, then the question should be, is given that the waiting list is now nearly a third of the waiting list is from minority communities, is a third of our resource on marketing and community engagement spent on community grants? If not, why not? If it's effective as an intervention, because you need to invest in those community-based conversations, and they need to then be done in partnership with the people who manage issues around the blood pressures, the diabetes, the kidney health, so that, for example, I don't do many, but the events that I ever run on organ donation, I don't do unless I have local GPs with me who are going to do the blood pressure testing, the blood glucose testing, etc., so that we are giving back to the community and we're picking up the early hypertensives, the early pre-diabetes, etc. And unless we're doing that and offering something back to the community and building their trust and looking after their long-term health, I think we're going to always struggle just to have a conversation in isolation about organ donation. So I think, hats off to what the SNODs do, but let's not pin all our hopes on the SNODs. We've got to, I believe, if the community grants program is effective, it needs to be a far more consistent offer across all communities across the UK.
Thank you so much, Gurch. I think Winnie has a question.
Yeah, thank you so much. I was going to invite, there's a specialist nurse from the Midlands. I'm not sure if she's on the call. I believe it's Danielle.
I'm here.
Good. Sorry, she had a case study to share with us, probably to help us along our discussion. Are you able to come on, Danielle?
Yes, yeah. So it actually links in really well to what we've been talking about. So I approached a family in one of the Midlands hospitals, and they were a global majority patient, and they were all of a Muslim faith. It was a 31-year-old lady with an out-of-hospital cardiac arrest. And it was quite an unusual case because they had a very close family friend who was a medical director at the trust. And he actually approached me before I went into the family. And he said that he kind of had he said, we need to do a collaborative approach, because he said, if you go in and ask this family, they will say no. And he said, let me help you, because he shared the same faith and culture. They had a lot of trust and respect for this gentleman. And we actually planned a collaborative approach with this family. So when we sat down with the two brothers of the patient, their first question was about their religion. So the medical director was discussing the Quran and how it wasn't against religion to proceed with organ donation. The brothers actually then, they expressed concerns about an early release of the body, which would have been the following day. And I explained that we do our best to expedite the process, and I asked if we could have verbal consent to start the process, send the bloods, and just start the background work to try and make this as speedy as possible. And they gave that verbal consent. They then just said they had to speak to their parents, who I think were back in Pakistan. So
You're on mute, Danielle.
Sorry.
No worries.
So sorry, I'll start from the beginning. Sorry. So I approached a family at a hospital in the Midlands.
I think we got, it was just the last sentence that we
just
missed.
The last bit. Sorry.
Yeah.
So the family had given verbal consent, and they were very engaging. They were asking about recipients, and they were asking about the law change as well. So we'd started the process, and the family then went away, and unfortunately they did come back and they did decline in the end. But this was based on their parents just couldn't cope with the emotional process of organ donation. It was nothing to do with belief, religion, any issues like that. So although it was a decline, I think it was a really positive experience that the family had engaged, and that it just really sort of brought home to me how important that medical director was in this process, because the family respected him. He shared their faith, he shared their beliefs, and he was working alongside me because he had the medical knowledge. And I think from what Gurch said about approaching with faith leaders, I think it would be really, really beneficial to have people that are, that share those beliefs and understand these issues more than I would and some of my colleagues.
Thank you so much, Danielle. That's really, really interesting. And also you talk about partnerships, trusted messengers, and kudos to yourself and your team for actually loving and facilitating that as well. Pallavi, do you see a sort of generational shift with certain elder members of the family declining authorization or consent given by younger members of the family?
Yes, yes, that happens. Um, um, Basically, in India, we have huge families coming to the hospitals. It's and in the region that I work, it's not just the families, it's the villagers and the panchayats, and sometimes it gets so difficult to even identify the decision maker. And yes, that is a challenge when there are too many people, and even if you are able to get some of the primary family members to consent, then someone else will come. Yeah, that remains a challenge in our country. I guess we just have to work within that framework. Also, very often the women folk don't come to especially in these regions, and it could be the wife who has to give the consent, and I'm talking to about 100 men, who have nothing to do with the consent, and sometimes you have to kind of, go through the weed and find a way to get to the wife, and we see that.
Thank you
with the
so
younger,
much for that.
Mhm.
I guess I'm going to go around the room now and ask each one of you if you had an unlimited sort of budget for manpower, investment and things. What is one thing that you would do to change the system to improve donations for across society for all members of our society, whether they're from Black and ethnic minority groups or otherwise? What would you do? I'll start with Gurch.
This requires no budget. This requires determination and willpower. So, one of the things I'm very proud of as a British citizen is when someone in the armed forces ever loses their life, sadly, they're always named and celebrated in the national media without fail. Without fail. It happens. You watch any news channel, they always acknowledge it. And I think that we should have the same relationship with the media, that if anyone, as long as the family are happy with it, if anyone chooses to become a deceased donor, they should be named and acknowledged. We don't need to say whose lives they saved to protect anonymity. And I think that would create a fundamental mind shift in this country that organ donation is normal, it's undertaken by anyone and everyone.
Thank you so much for that. And you're right, it's not so much about, well, it's transformational for the recipients. It is about that gift that they give so willingly and so bravely. And Aninda, what would you do? I mean, you're already demonstrating great results in Donor Northwest, but if there was something, what are your visions for the future?
Oh, no, just
Yeah, no,
this, which, sorry, I heard India. Sorry.
But you can go ahead, Pallavi.
Yeah.
Please,
No, I
please. That'll give
just
me
so
more time to
agree
think.
with Gurch. We are not even doing this bit right. Just acknowledging and honoring families, even that bit if we got right. There's this family that I go to meet, and they're very poor. And the boy who died was the primary breadwinner of the family, and I know they're struggling with funds. But every time that I do go to meet them, the mother says nobody ever came from the government. That's all she wants in this. She's never brought up financial issues. She's never brought, I don't know how they are managing their expenses. And I go, she's saying, you come, ma'am, but nobody ever came from the government. If you just got that bit right, honoring families and giving them that status, as Coach said, of a martyr, of someone to be held up, I think we don't even need to talk about incentives. That bit needs to be done well and sincerely.
Thank you so much for that, Pallavi. Now, Aninda, over to you.
Yeah, no, thank you.
Sorry.
Yeah, I really echo everything you all said. I think, for US, there is, obviously the policy makers have to be aligned. That is a huge deal here. And then we talk about media a lot, right? Especially these days. One of the things that hugely impacts, authorization especially, is whether that family has heard about donation before they are in that hospital with their loved ones dying in front of them. So that is so critical. And if they have heard about donation in a positive way, they'll be more prone to saying yes. And if they have heard about it in a negative way, or they're just hearing about it and doing a quick Google, and all you see in the first 10 results is bad, negative stories about donation, guess what will happen, right? So I think, that creating that culture of donation, it has to be across the board at different levels and all the stakeholders owning up to it. You cannot just kick the can on to the next one and say, hey, you need to do better. We all need to do better and find ways to do better.
So right. Thank you so much for that, Aninda. Rachel, if you could change one
Thank
thing,
you very
what would you?
much. Well, I have a few things. I don't know if I can share all of them. Not
We've
just
got 2
one.
minutes.
Okay, thank you. So the first one, it's mainly, if it's possible to get more training for us, specialist nurses, on cultural awareness, to understand how the beliefs that mainly get the the community leaders to attend that meeting, to share with us. We can ask them questions, more of that. And also more community engagement, if we can just have, funding or time to facilitate that, so we can go and attend. And another thing, this is the last one, which is we should promote organ donation on the front door of the hospital. I find it really hard when we always hide. And I know we talk to people in the community, but when it comes to hospital, we like at the back door trying to sneak our way through. If we can fund that service so that it can be no more thing, no taboo, no more end of life care everywhere, I would really love that.
Thank you so much for that, Rachel. You're absolutely right. You are our unsung heroes, and you have the unenviable task of approaching these families. And you're right, we should walk with our heads held high. We don't have to lurk in the darkness, wait for someone to actually allow us into conversations. No, so thank you so much for that. Thank you to the panel members. I think this brings us to the end. Really enjoyed this discussion. Are there any final comments? Please feel free to share them with us. We've had really interesting and really positive, affirming chat as well. Thanking all of you for your insightful comments. Thank you very much. I'll hand you over to Winnie and John.
Thank you very much. Really, really good session, and certainly worth dialing in for the afternoon for. So thank you very much to all the speakers throughout the whole of today. I'm just going to hand over to the final session to John Richardson, our Assistant Director for Organ and Tissue Donation, and also to Winnie Andango, who has organised today and is also our Inclusive Culture Manager for Organ and Tissue Donation Directorate. So over to John and Winnie. Thank you.
That's great, John. Thanks very much. I'm really delighted to be invited to say a few words to close the conference today. I'd like to start by thanking Winnie and all of the organising team for putting together such a powerful, engaging programme. I'm absolutely so proud to be part of a team that values equality, diversity and inclusion in the way that we've seen today. I know from personal experience that it's no mean feat to plan and deliver a conference of this quality online, and you've done a really fantastic job. Of course, it wouldn't have been an online conference without a few small technical hitches, and I think you've managed those brilliantly. Personally, I've found the day to be really moving and inspirational, and I think there's some really strong themes of engagement, innovation, working both in partnership and within communities that have been strong in everything that we've heard. These themes really highlight the work that we've done well, as Gurch and others have mentioned, but also where we need to redouble our efforts to ensure that we meet the need of those 8,000 people that are waiting for a transplant, and that we maximise the equity of access to both donation and transplantation. I'd like to thank all of our fantastic speakers who've given up their time to share their thoughts and words with us today, but particularly I'd like to thank those that have shared their personal experience of donation or transplantation. That always really highlights to us the importance of the work that we do and why it's so vital that it remains our focus. Just before we close, we'd like to take a moment to recognise those who were nominated for Cultural Champion Awards this year, and to share some of the detail from those nominations, which really highlight some of the great work that they do. So Winnie will join me to help me do this. Some of our nominees you've heard from today, and some have contributed to the organisation of this conference. So without further ado, I'd like to start by recognising Amy Preston, who's one of our professional development specialist nurses. Amy was nominated for advancing EDI education and building community collaboration with external partners. And the person that nominated her said that Amy's been a great support in advancing EDI education to the Northwest Organ Donation team. She also goes the extra mile to support and create connections between community organisations such as One Voice and Caribbean and African Health Network and the Northwest team. Her dedication creating an inclusive culture and improving outcomes for ethnic minority families is admirable. Congratulations, Amy.
So our next nominee is Dan Ginley. Dan is an administrator within the National Referral Center in Speak. I got to meet Dan in one of their workshops, EDI workshops. He's been very enthusiastic. So Dan was nominated. He's been nominated for so much work that he's done. Part of it is being part of the planning group that organized the workshop earlier this year. Excellent presentation of his own personal experience, and he's been taking time to be enthusiastic and celebrate with the team. So well done, Daniel.
Thanks, Winnie. Next, we've got Lucy Dames, who's one of our lead nurses with the London Organ Donation team. Lucy was nominated for promoting EDI and cultural education and promoting organ donation in the community. Lucy's the EDI lead for the team. She's always encouraging the London team to participate in community and cultural engagement to promote organ donation. She's lots of contacts and always invites us to the cultural days to promote organ donation. She's done a lot of networking over the years and has made an incredible effort for this to happen. And of course, is one of our organisers of the great conference today. So congratulations, Lucy.
Well done, Lucy. So the next nominee is also one of the organizers for the conference, and it's Radha Sundaram, and she's amazing. So she's been nominated for being the clinical lead for organ donation in Scotland and the EDI lead. Radha goes above and beyond as a diversity and inclusion Claude, working with all members of the community. She has links in Glasgow, has opened up teaching to all medical students on organ tissue donation as part of their curriculum. Radha has been on air in radio hours a number of times, promoting organ and tissue donation and taking questions from the audience. Last year, she was involved in Scotland's first Diversity Inclusion Day, a very successful day with a number of speakers attending and educating the Scotland team on health inequalities and faith issues. Most of the events that Radha attends are at weekends and evenings, and she gives up her time to do this. Congratulations, Radha.
I think I'll just say there, Radha, your passion and enthusiasm just bursts off the screen. So I think really your second career should be in media, but great job.
Thank you so much. Thank you.
Our next nominee is Bushra Riaz, who's the Policy and External Affairs Manager for Kidney Research UK. Bushra was nominated for raising the profile of donation and transplantation alongside strong community engagement. Bushra works tirelessly engaging with stakeholders and government officials, raising the profile of donation and transplantation alongside strong community engagement. Her positivity and passion is evident in everything that she does, and I think we can all attest to that. So congratulations, Bushra.
Congratulations. Our next nominee is Christine Young. Christine is one of the specialist nurses in Northern Ireland team. Christine was nominated for going over and beyond to educate their team about culture and EDI related issues. Christine always goes above and beyond to educate. Sorry, I've gone over there. Yeah, she puts together fantastic cultural days for the team and often is buying props from her own pocket. She's proactive in all culture and cultural and faith leaders, or in inviting cultural and faith leaders for education days. Sorry about that.
Thanks, Winnie.
Congratulations, Christine.
Our next nominee is well known to many on this call. Harpreet Matharu is one of our lead nurses in the Midlands organ donation team. Harps is nominated for her enthusiasm and dedication to improving cultural education for SNODs and supporting EDI work in OTDT. The person that nominated her wrote that Harps has been a great motivator and support to the team. She makes time to lead the team in EDI and cultural education. She supported me in my role as an inclusive manager in various projects and has brought forward valuable ideas which have helped advance equality, diversity and inclusion in OTDT. So congratulations, Harps, and thanks for all the work that you do.
Well done, Habs. Our next nominee is Syed Ahmed, a consultant in nephrology from Sunderland. Syed is nominated for his commitment in promoting organ donation awareness and is also a co-author of articles including informing UK Muslim community on organ donation. Syed is committed in promoting organ donation awareness in the community and has attended many promotional events alongside the Northern team lead nurse. He's a member of the British Islamic Medical Association and has been involved in team regional community events and education regarding organ donation. Syed is very passionate about making a difference and is warm, funny, and engaging. So well done and congratulations, Syed.
And our final nominee is Dr. Richard Schaub, who's a consultant in intensive care medicine and anaesthesia at Barnet Hospital. Richard was nominated for his exceptional dedication to community engagement and cultural education in donation. He served as the clinical lead for organ donation at the Trust for over 10 years, advocating for organ donation and supporting donor families within the Trust. His commitment to raising awareness extends beyond clinical practice. He's a passionate educator who's delivered expert teaching across the Trust and has played a pivotal role in training London organ donation link nurses. Beyond his hospital work, Richard's partnership with the Jewish Organ Donation Association highlights his exceptional contribution to community development and cultural education. His efforts have helped break down barriers, dispel myths, and encourage informed decisions about organ donation across diverse communities. So again, thanks for all your work, Richard, and congratulations. A huge thank you to all of our nominees for all of the fantastic work that they do in generating discussion, promoting donation, and being great role models within their teams and communities. I've saved my final thank you for all of you who've given up your valuable time to join the conference today. I hope that you found it as inspirational as I have and that it adds some fuel to your fire to continue the really important work that we do. Thank you, and I'll hand back to Winnie for a final word.
Thank you so much, John, for being available today, and just really, it's amazing to be able to see our senior leadership engaged in ADI. We are really lucky in OTDT to have senior leaders who get it and who constantly promote diversity and inclusion, and really you can see that they have a passion and care about inequalities and making sure that access is equitable. I also cannot forget the amazing audience we've had today. Really, I'm impressed. I wasn't sure what it would look like, what the day would look like when we put this up and when we started planning. But yeah, you have all been so supportive throughout the process, had messages from lots of people throughout the process, just inspiring me to carry on and saying how amazing this is. So really, really grateful to all of you, all our nursing teams in OTDT and across the NHSBT and all other colleagues as well. All the leaders that have been able to be here as well, our admin staff, the people that have helped in the background. So really, really grateful. And I will also really want to thank the speakers. I think each one of you, when I approached you the first time, I didn't get a no, or I will think about it. You are all ready to support. So really huge thanks to you all. Aninda, for joining us early in the morning. I hope your day goes well as you carry on. And I would just want to say a thank you to our planning team today. Throughout this process. Lucy, are you able to put your camera on? As unfortunately, Amy and Joe are not on the call. I think they must have left, but they've been fantastic. I think for me, what this has shown me is just the power of collaboration, is that we cannot, as much as I wanted to put up this conference, I couldn't do it on my own. So just being able to tap into Radha's knowledge and insight, and bringing in Pallavi, being able to tap into Lucy and her team in London and what they do, being able to hear ideas from John. John has always been on my side. So John and I work very closely. And And it's just amazing to have this kind of team. And of course, Amy, who's been nominated today as well, and Joe. So really grateful to all of you for what you've done. We have this recording available, and we'll be able to share it with you. And please keep going, carry with you the things you've learned today. Go away and discuss with your teams. What have you learned? What can you take away? What can we implement? How can we continue to collaborate with the people that we've met today? So reach out to our speakers and panelists on social media. I'm telling you, social media is an amazing place if we use it well for collaboration, for networking, and for being able to improve in what we are doing. So thank you to everyone, and I hope you have a lovely, lovely evening. So thank you.